What's a good breastfeeding latch and why is it important? Hi, thanks for joining me today. I'm Tara Udall from Postpartum Nurturing. So having a good latch when it comes to breastfeeding means that it feels comfortable for the mama, no pain, and comfortable for your baby. So there might obviously be some discomfort at the beginning for a few seconds or a minute, but if it continues throughout the feed and with each feed, then you know that there's something not quite right. So a good latch also helps the baby to drink easily and effectively. Sometimes a good latch can be very challenging, and especially if the baby has had a few issues at birth, there's been separation after the birth, or there's been complications and medical interventions. So that is quite common. Also, babies feed differently at the breast than they do on a bottle, so their sucking is different. With a bottle, you can basically force a firm teat into the baby's mouth, even if they're not really interested. A baby doesn't have to open their mouth very wide, and the teat usually it just sits sort of inside the mouth. Even if it's a long teat, it doesn't go in very far. And basically milk drips through the hole into the baby's mouth. So when the baby sucks, more milk will flow out, and usually can come out in quite an abundance. And then the baby can also use her tongue to press against the teat to slow the flow of milk. But drinking from the breast is very different for your baby. So your baby actually needs to participate more actively. You can't force your nipple into the baby's mouth. They've got to have their mouth wide open and actually take the nipple and the areola in, which means that the nipple is placed further back in the mouth. It rests against the soft palate rather than the hard palate like with a bottle. The baby isn't sucking from just the nipple, so keep that in mind. This will cause pain and eventually crack nipples. Your baby's taking in as much of the breast as they can. And basically, she holds the breast in place by sucking and using her tongue in rhythmic waves to squeeze the ducts in the breast and the movement of the lower jaw to compress the ducts further, which releases the milk into her mouth. You'll see the baby's jaw, the bottom jaw moving. Also, our breast milk actually changes during the feed as well, as from one feed to another. So a good latch is really important throughout the whole feed, so that your baby is getting a full range of the milk, and it's not just the abundant flow at the beginning. And it's a gradual change in the milk, and it's not, as I'd always been told, fore milk and hind milk. It's not like as abrupt of a change as that. The composition of the milk depends on how recently the baby last nursed, also the time of day, and the nutrition, rest and support the mother is receiving as well. I personally found by around 5 p.m, pretty much with all my babies, because I'd been busy all through the day, I hadn't rested enough, and I hadn't been eating the right nourishing proteins and fats. My milk was lower at that time of night, and my babies were more restless. So if you find that, you look at things like that. Also, the rate of the how the milk flows changes throughout the feeding as well as the beginning of the feed. So after a few seconds or a few minutes, you'll feel that letdown happen, which that's when the milk's flowing really quickly. You might even have a problem with milk leaking everywhere. I used to just think about feed time with my baby, and I would feel that letdown. And it would, milk would just start leaking out, and you'll feel this little tingle coming down through the nipple. So that's the letdown reflex. As the feeding continues, the flow normally slows down. So then that gets the baby sucking more, and the increased sucking encourages more milk production, and your body will adjust to the baby's needs. So if they are cluster feeding, your body will make more milk to keep up with that demand. And here's something to note: if you start to substitute some feeds with a bottle, it will mean less stimulation of your milk ducts, and so the body will produce less milk to accommodate, because it's sort of thinking, oh, the baby doesn't need as much now. So latch the baby as often as required. Listen to your baby. If you need to build up your supply, make sure that you're drinking plenty of filtered, clean, fresh water, and eating highly nourishing, fat and protein rich foods, as well as getting rest. Now, if you're having any troubles, reach out to a breastfeeding support person or a lactation consultant sooner rather than later. And I am a breastfeeding support person, by the way. So just see someone who actually has up-to-date information on breastfeeding. I was told for pretty much all 5 of my babies to break the suction with the little finger to detach the baby, and then to start again, like to latch them, and that happened like 3, 4, 5 times sometimes. However, I have learned that this is outdated information, and it can end up being very frustrating for mum and baby, which I experienced, and that causes more stress, which then causes more angst, and it just goes around. So try repositioning your baby first while they're latched. Check their lower lip, and if it's tucked in, you could gently roll it out. If it's still painful after a few adjustments, then definitely detach with the little finger. I can show you that in another time. And it's just not advisable to do it too many times, like 3 or 4 times in the one feed. But don't wait for the situation to be desperate. You're not a failure. There is nothing to be ashamed of for reaching out for help. Breastfeeding is a learned skill. For some people it comes naturally, for many it doesn't. And also many women have not even had the experience of being around babies or breastfeeding mothers when they were growing up or as they were older. In other cultures, where villages would have many women, sometimes they would be topless, but they would all be breastfeeding wherever and whenever the baby needed. It was just part of it. So it's something that was there. So if it's not something that you were around, and it just means it didn't become part of your unconscious program. And so be gentle with yourself. As I said, it's a learned skill, and anyone can learn it. And it takes patience, it takes practice, it takes the right guidance, and it also takes possibly some clearing of any fears or traumas that may have happened to you that can be subconsciously preventing you from relaxing around having the baby suckle on your nipple. Your baby can also be assessed by a certified lactation consultant, like for tongue tie, if that is something that's an issue. And so there's definitely things that we can help you with. So don't wait for weeks of pain. Don't even wait for days of pain and an unsettled baby. Let's just leave all of that and know that it's very common. It's not normal, but in fact, so one third of women only reach their breastfeeding desires and their goals, which is, I find heartbreaking. And which is why I'm wanting to help more mums have a successful and joyful breastfeeding experience. So please, mama, reach out. And even if you're given just one simple tip, it could make all the difference for you and your bubby. Because pain is not common. Pain is common, but it's not normal. And we can address this. If you need to chat about anything, book your free call in with me with the link, or reach out for any questions. And many blessings for your wonderful and joyous, but yes, sometimes challenging, breastfeeding journey. Thanks for joining me. I'll talk to you soon. Bye.